I'm going to tell you the unbelievable story about how the development of a cancer drug ended up leading to the discovery of a rare type of food allergy that is now becoming more common, and it's a call to action because this is related to climate change. I'm a board-certified allergist. If you want to learn more about allergies, asthma, and immunology, go ahead and hit that follow button to learn more information. In 2004, scientists were developing a medication called cetuximab, which is a monoclonal antibody, meaning a lab-grown antibody that is a tag that had the ability to bind to the epidermal growth factor receptor and stop the ability of epidermal growth factor from sending signals to colorectal malignant cancer cells from proliferating as a way to help slow the spread of cancer cells. However, by 2006, researchers realized that many patients were developing severe allergic reactions to this medication. Like within 20 minutes of their first infusion, they were getting symptoms such as hives, swelling, wheezing, problem breathing, vomiting, or a drop in blood pressure, and these were potentially life-threatening situations. Over the next couple of years, scientists were able to figure out why these patients were having severe, potentially life-threatening allergic reactions to cetuximab, which was published in the New England Journal of Medicine in 2008. They reported that these patients who were having severe allergic reactions to cetuximab were carrying a protein called immunoglobulin E, or IgE for short, which is an antibody, a protein tag that can cause severe allergic reactions by binding to a very specific site on that medication at a site where there's a sugar molecule called galactose alpha-1,3 galactose, also known as alpha-gal. When it was able to bind to that portion as well as to a mast cell that's a part of your immune system, it releases several chemicals that are listed here that could cause severe, potentially life-threatening situation called anaphylaxis. Now, oddly enough, many of the researchers and physicians who were working on this issue related to cetuximab were coming out of the University of Virginia, and some of those physicians had noticed that there were patients coming into their practice complaining of these odd episodes of hives all over their body or swelling or severe allergic reactions, oftentimes happening in the middle of the night. The majority of these patients also spent a lot of time outdoors, which didn't make sense at the time, but as we tell this story, it's going to make more sense in a bit. Also, these patients had no obvious immediate cause for these symptoms, but several of the patients said that from time to time they had eaten red meat about 3 to 6 hours prior to these symptoms occurring. After careful history taken in consideration, these physicians and scientists ended up doing skin testing with fresh red meat on these patients and often were having very positive results. So these scientists and physicians were thinking about those patients who were having severe allergic reactions to cetuximab due to a sugar molecule called alpha-gal, and then they were thinking about other patients who were having severe allergic reactions possibly to red meat, and they mapped them out and found that they kind of overlapped, especially in the southeast United States, also where there's a distribution of a tick called Amblyomma americanum, also known as the Lone Star tick. It turns out that alpha-gal, that sugar molecule that's found on cetuximab, is also found in pretty much every mammal except for humans and some primates. So examples include cows, lamb, pig, rabbits, and deer. Deer are carrier for the Lone Star tick, and in their saliva there's also alpha-gal as well. So when hikers in the area were being bitten by these Lone Star ticks, their immune system will become sensitized to the alpha-gal sugar molecule and produce specific IgE antibodies against it. So 1 to 3 months after the tick bites, these patients would then consume red meat, and within about 2 to 6 hours later they develop these severe, potentially life-threatening allergic reactions. The really strange thing about this is that normally in food allergies, the symptoms are pretty immediate. They happen within an hour, and they're reproducible, meaning every single time, even at tiny doses, you could have a potentially life-threatening situation. But with this alpha-gal red meat allergy, most of the time these symptoms are delayed about 2 to 6 hours after ingestion of that food, and also it's not always consistent, which is why it took so long for patients to figure out what was going on with them. Now, in researching the history behind alpha-gal allergy, I came across this report that there were actually 2 people back in 1989 who had found a connection between 10 cases of delayed reactions to mammalian meat and those who had been bitten by ticks several weeks to months later in Georgia, which these findings were presented to the Georgia Allergy Society and the CDC in 1991, but there were no additional reports or statements issued by either of these organizations. Now, patients who have alpha-gal allergy, they have a lot of challenges ahead of them because they have to avoid all sorts of different things that's related to mammalian products, including beef, pork, other meats, dairy, cheeses, gelatin, lard, and there's also a slew of medications as well. Also, in order for these patients to potentially outgrow this allergy, they have to lose that sensitivity, and that means they have to avoid getting bitten by ticks in the future, because if you get bitten by a tick, you can become resensitized to alpha-gal. And so I bring this map up because the initial distribution of that Lone Star tick was in this lighter color here. This was a map from 1945, and then it's now expanded further north, which brings me back to my earlier point in the beginning of the video, which is the fact that rising temperatures as a part of climate change is one of the main reasons why we are now seeing Lone Star ticks moving further and further and further north, and we're seeing more and more cases of this meat allergy. Thank you so much for listening, and I hope that you learned something new about alpha-gal syndrome. If you have questions, feel free to leave them in the comments section. Like and follow for more information. I hope you have a wonderful day.